I think that it's 10:02. I want to thank everyone for joining today. Let's take a moment to let our pastor, Walter Jones, open us in a reflection, and we can move from there. Pastor Jones?
Thank you so much, Representative Ford, and thank you for the opportunity to join the meeting with you all as well. Can we all just take a moment now to just center ourselves and touch and agree, and then just give God the praise for yet another opportunity. So with all hearts on one accord, let us pray. Eternal God, our Father, we thank you for this day. We thank you for your mercy and for your amazing grace, for the anointing of your Holy Spirit. Father God, we thank you for, in spite of all we've been going through, all of the uncertainties in the land, you look beyond our faults and saw our needs and continue to bless us indeed and enlarge our territories. So on this day, Father God, we lift up to you ourselves as a living sacrifice, asking you to touch us, guide us, and purge us from all unrighteousness, that you would create in us a clean heart and a clean mind, that we can continue to do the work that you've called us to do. Father God, we lift up right now all of the leaders in this land, on the federal level, state, local, and all of those who are on this line today, those who are servants for social change and community empowerment. Father God, we pray that this meeting be done in decency in order that you will continue to guide our state rep as he continue to labor for righteousness' sake, as he continue to bring folks together of one mind, one spirit, and one heart to look out for those who are less fortunate. Your word is crystal clear that when you looked out for the least of them, you looked out to me. And so, Father God, we just thank you for all you've done, all you can, all you will do, as we continue to look to you for our help and our strength, and no other help we know. And then, Father God, in this season of uncertainty, these seasons of the pandemic, these seasons that we're going through that we don't know which way tomorrow may bring, we just thank you for yet this day. We thank you for life. We thank you for love. We thank you for joy. We thank you for forgiveness. We thank you for long suffering. And we thank you yet for another opportunity to touch and agree that you can do all things but fail. And we thank you for all of these folks who have come together to share love, to share understanding, and to share best practices and ideals on how we can improve our land, how we can heal our land and work to heal our people. And then, Father God, we just thank you for what you're going to do, what you've already done, and what we can witness right now what you've done in our lives. And we give you all the glory and all the honor. In Jesus' name, amen.
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 I would like to first go over some housekeeping. I would say, how you had those meetings. So the housekeeping is the bathrooms are, you know where they're at. So feel free to go to
Good. I'm like, where's she going with this?
So, I would say thank you all for coming on this Saturday. You have nowhere else to go. It's raining and the city is shut down. So I think that I appreciate you guys taking the time for all things COVID today. If we could just take a moment to put your information in the chat for everyone. We'll take a pause so that everyone have your contact information, because as we go through the meeting, we will see that this meeting is all about collaboration and doing everything that we can to help the people on the West Side. And so let's take a moment to add our contact information in the chat.
Well, Rep Ford,
Yes.
if I may, I'm with the Dealer with a Hospital over at the Columbus Refectory. We're giving out toys.
Yeah.
Right now, even though it's raining and Santa's getting drenched, but we're giving out toys. So we're not at home. And I wish I was with you with the blue sky behind you and the flag flying.
I will put your information in, Mr. President.
Yes, sir.
Okay.
Thank you.
How's the turnout over there?
It's slow right now, but we have it scheduled because of COVID. We get assigned people times to come through, drive through. We'll give them all pre-packaged of toys for their families. We have over 200 who signed up, but we have extras for those who may not have signed up and just show up. So we've got plenty of toys. Everyone has been so generous. And we do this every year. Camille Lilly leads this for us. And this is our 26th straight year that we give out a choice. The families are less fortunate. And the last 2 years that I've attended, we had mothers and family members tell us this would be the only Christmas they ever got. So this is one of the things that we do outside the four walls of the Loretta Hospital.
Okay. So the way we will do this is we will, if you have a presentation that you would like to make, we will ask that you raise your hand in the chat now. And if you find out that later on you would like to raise your hand, that's okay too. After you make your presentation, then it would be great if you lower your hand yourself. We know why we're here. I'll tell you, the goal is to make sure that we pull together every resource possible so that we can meet the needs of the families on the west side of Chicago. Many people have been doing great work during the pandemic. And we know that things are changing. We know that families are struggling. And we know that there are resources out there that we would like to share with people and put together a plan for all things COVID. Testing, we will have some people on here that will talk about the possibility of having sites that could be used if your site wants to be a testing site. We have people on the call, I believe, that will offer your location to be a testing site. I think President George Miller, they've been testing on the west side for a while at the Loretto Hospital. We know that this pandemic has caused a strain on all of our mental health. Everyone. I don't know if anybody could say honestly that the pandemic hasn't had some impact on their mental health. We know that substance use disorder and people are still struggling, and we know that the substance use disorder campaigns are still going on the west side. I see Lee Rush is on, and with the West Side Heroin and Opioid Task Force. But we know that in the city and in the state and all across the country, the opioid epidemic is still growing, and because of the pandemic, it's been ignored. So our goal today is to make sure that we can not let any of these problems be something that we can't deal with. I know Dr. Huggett is going to present something now on the opioid and substance use disorder. And I know that Sister Yab from the community will be, she's an epidemiologist, and she will talk about testing. And, you know, and there are other people that will be on that will be talking about other stuff, but I see their hands up. And then we have someone that will be talking about, I think it's going to be Dr. from the lawyers, some of the lawyers, but you'll hear who they are. Then we have educators on that will talk about how we need to work together for the young people. And the big plan that I have out of all of this is we're going to be going back to Springfield in January. And my goal is for the West Side to have appropriations requests. We can do that. If we come together as a team, we put together our needs, and we could get it in the budget so that we could serve the people on the West Side. We'll get it straight to the governor, and I'm on the budget team, and we can make things happen for the West Side of Chicago. And of course, we have Dr. Safir that's heading up the behavioral health, West Side Behavioral Health Task Force. So we will have Dr. Safir speak as well. So everyone will be speaking that would like to speak. It's a basic.
Rep Ford, I'm sorry, let's not forget Dr. La Shawn is on as well.
We recognized him.
Okay, thanks.
Who are you? So that they know. Say your name.
It's Virgil Crawford.
All right. All right, let's go. I'm gonna give, if Dr. Huggett is ready, I'm gonna go right to Dr. Huggett and give him the ability to be an administrator. Dr. Huggett, could you handle that? Dr. Huggett, if I give you the ability to be administrator, can you handle that at this time?
Sure.
All right, here we go. I'm gonna take it back from you though, just so you know. Temporary, you know. Let me see here. Let me see if I could do that. So, Dr. Huggett, while I'm queuing you up, you want to tell us what you're going to be doing? Oh, you got it. Good.
Sure. Sure, Rob. One thing that might be helpful as I'm trying to open this is maybe to look at the dashboard for the city of Chicago for coronavirus that I'm pulling up. This kind of gives maybe some background for our overall discussion for this morning, if it will be able to pull up here. And I think this dashboard has been particularly helpful thanks to CDPH and epidemiologists like Simpson and other epidemiologists looking at this. And what we're able to do with this is really look to see what is going on in the city, and particularly regarding deaths. So I'd like to just kind of pull it up if I could, because I think, we kind of are hearing, that in Illinois, we've broken the 14,000 death number in Illinois. In Chicago, we're over 3,700 deaths in the city of Chicago since March 1st. And I think what is worthwhile looking at are the deaths per race or ethnicity. And you can see this in this graph right here.
Dr. Huggett?
Is at early.
Dr. Huggett? I think we're seeing maybe the wrong screen. We have the U.S. overdose deaths appear to spike with the very good graphic on the opioid-related overdose deaths. Were you putting up COVID?
I was trying to put up COVID. Let me see if I can get to a different screen here.
I mean, I think that really does, what you're showing is very powerful, showing the opioid on the west side.
Okay, let me see what I can do here. Okay, are we able to see this screen now with the COVID dashboard?
No.
No.
Okay, yes.
There it is.
Yes.
Is the COVID dashboard up now?
Yes.
Okay, so I just wanted to start with this before I went to the opioid thing, because this is, we're talking COVID, everything, all COVID-19 with Rep. Ford. And I just kind of wanted to, point out that this really is a good resource for us to look at. And that early on in the epidemic, certainly, as you can see in March and April, that, deaths amongst Blacks were, exceedingly disproportionate. 70% of the early deaths were amongst African American, and even still, 1,489 African Americans have died from COVID-19 disease out of the 3,700 deaths that have occurred. So I think it's really important to kind of reflect on these data. Also, we can also see that in Latinx neighborhoods that the positivity rate is really huge, and it continues to be huge right now, almost 30% positivity. So that is really something to pay attention to. So I'm going to go back to this screen, and this really is going to go, now I'm trying to share the opioid-related overdose deaths. Is that up on the screen now?
Not yet. Yes.
Okay, so thanks for putting up with the screen sharing thing. But I think that what we need to realize that on the west side, we are being hit by two things. One is the coronavirus pandemic, and then the opioid overdose epidemic. We have an epidemic within the pandemic, really affecting us, really greatly on the west side. And these are data from the Chicago Department of Public Health, which really says that there's been a 55% increase in opioid-related overdose deaths in 2020 compared to 2019. And we can talk about, Rep. Ford has already kind of alluded to some of the reasons perhaps for that, related to social isolation, the problem with access to medical care with clinics closing. At some points during the pandemic, of course, even pharmacies were closed. We had problems, people having access to even getting their medications. So I think that this coronavirus pandemic has really greatly increased the problem with people getting access to proper medications. Of course, what also this document illustrates is that 83% of the overdose deaths were related to fentanyl. So fentanyl over these last few years has really infiltrated our west side, and most of the folks who are thinking that they're getting heroin, they are actually getting fentanyl, and sometimes even pure fentanyl. And this is just from 2 days ago. This was a headline in the Tribune saying that 2020 is the deadliest year ever for Cook County overdoses due to opioids. So we're on track to exceed 2,000 opioid overdose deaths. As I said before, we've already exceeded 3,700 COVID-19 deaths, but we also have 2,000 opioid overdose deaths. This exceeds our 2019 record greatly. Last year, we had a record of 1,277 opioid overdose deaths, 1,498 so far, but over 600 medical examiner cases are pending. So it's estimated that we're going to exceed 2,000 deaths. Blacks and Latinos make up more than 63% of these deaths, men more than a quarter, and the age range most vulnerable are those who are 45 to 54. Now, what can we do about this? The first thing, and this is my last slide, I just have these 3 slides, and everyone in contact with somebody using opioids really should have Narcan or naloxone on hand to reverse an overdose. You do not need a prescription for this. Most pharmacies on the west side, if you go to them and say, oh, I need Narcan, they will give you a prescription, they will give you that medication, and they will charge your insurance for that. You do not need to have a diagnosis of opioid use disorder or any sort of addiction or anything like that to get that. If you are riding around or working on the west side, or if you have family members that are using opioids in your house or building, it's very, very important to have this medication. The second point is that really treatment still works, and taking medications like buprenorphine, naloxone, or Suboxone, and methadone, they really do help in terms of treatment. Socially distanced support groups are still happening. They are still important. 12-step groups, NA groups, AA groups, they are still around. And one resource would be to contact the West Side Task Force, Lee Rush's group, and they are on the ground and know where these meetings are happening. We at Lawndale Christian Health Center are still having our recovery groups Monday, Wednesday, and Fridays on Ogden Avenue. Keeping in contact with others to reduce social isolation is really important during this time. So even by telephone, I know a lot of our patients do not have telephones, but I think that this is an important point. And then I can't leave without plugging, making sure that people get their flu shots and the coronavirus vaccine when it comes out. Because if we really want to bend this pandemic down and make treatment more possible for our folks living with opioid use disorder, this is the way that we're going to end this. So that's my contact is on the lower right, and then the West Side Task Force email is here for other resources. Thank you, Rep. Ford, for this opportunity.
Thank you, Dr. Huggett, for laying out the issue and offering some solutions. Let's go right to Lee Rush. If he would like to give a report about the West Side Heroin Opioid Task Force, followed by Dr. Safir, the behavioral health. And then we're moving right to the hands raised, which Lee.
Yeah, thank you, Rep. Ford, and thank you, Dr. Huggett, for kind of laying the groundwork there. I just wanted to add, if you want to get on our task force email list, just copy the email address there and send me an email, and we'll put you on there so you can get all the information we're sending out. As Dr. Huggett mentioned, we're still doing outreach out there. Lou Sias is our outreach director. Has a team of 4 or 5 people. They've been going out since September 2019. They've trained over 2,200 people. And when I say they're out there, they're going to the various hotspots where people congregate either to purchase or use or hang out with folks. So they've, like I said, trained over 2,200 folks since September of 2019. They've given out close to 5,000 doses of naloxone, either the nasal or the injectable. And our other partners probably have trained 1,000 plus more people through their various outreach efforts or through their own facilities. Part of what's happening based on the outreach is that we're starting to create a warm handoff relationship from the street to medical stabilization units at hospitals and detox centers, all the way through to treatment programs. The whole idea is with outreach is you have peer support, folks who have either had lived experience or live in the community, are not afraid to address folks on the street and be able to talk the same language, and then encourage folks once they're ready for treatment to let us help them connect. And we're creating, like I said, warm handoff, where if somebody raises their hand, we've essentially close to eliminated the wait time, either through a phone connection or a direct call to one of the hospitals to get somebody in, even with transportation. We feel that when somebody's ready, it's time to go. And if we connect that with people who are doing medicine assisted recovery or medicine assisted treatment, where they can offer Suboxone and methadone, et cetera, groups like Lawndale Christian Health Center, Thresholds, Bobby Wright Mental Health Center, and the other treatment providers, we want to make sure that we have that quick connection as well. The other piece that's the task force is involved in, and when the task force isn't just Lee Rush and this team here, it's 400 plus organizations that are involved and we're doing this work daily, and we're just trying to connect with each other and make sure that we're closing gaps, communicating the issues out there in a very quick and deep way. But we're also involved in a project that is funded through Super to explore the West Side leadership and residents' openness to exploring developing overdose prevention sites, those places where there's medical supervision available, so that if somebody who is using drugs that they may have purchased on the street, there's medical personnel to be able to step in and reverse the overdose. And that's in addition to having additional ancillary services such as medical services, housing services, all those other pieces that go concurrently with opioid use disorder and substance use disorder. So that's kind of my overview. We really believe we're starting to close gaps. We're identifying who is really, I guess, engaged in this, wants to get out there. I know that many folks and organizations have had to pull back from their connection to the street outreach, but we encourage you, if you have not seen it, there's about every couple of weeks, there's a new schedule that comes out for the outreach team. We encourage you to give Luther Sias a call or give an email to me through the Westside Yahoo address, and we can set it up so you can come out, see what's going on, either at the corner of Jackson and Pulaski or other pop-up sites, or just take a stroll with the group as they walk through some of the hotspot areas, more specifically along the Pulaski corridor. So think that's my overview.
Yes. So there, thank you so much. We're going to make sure that we have a budget request for the West Side as it relates to needs for for substance use disorder. And so are there any questions? I know PCC is on and they do a great job also working with substance use disorder, and so does the Loretto Hospital President Miller. Any questions before we move from substance use disorder for the from the attendees?
I'll just make one quick addition to the evidence-based treatments that are out there. I mean, Dr. Huggett and Lee named some great pieces, but one other is contingency contracts, which basically someone sets a personal goal, and when they hit that, they get help with social determinants of health, grocery card, transportation voucher, first month's rent. So it's another piece that has evidence, scientific evidence. It does work, and I know others are using, but would love to see that here on the West Side, helping more people, both with their social determinants of health and in the recovery.
Let me just add, I gave my spiel without mentioning the concept of harm reduction, and that needs to be said. We really use that approach. We meet folks where they are at their model of the world and what they call a significant step or a step they are making towards health. We want to encourage it from where they are. We don't have a particularly standard that somebody has to meet to be able to be connected with us. And I think that's the main approach across all of our providers on the West Side.
This is Ruchi Fitzgerald. I'm a physician, addiction medicine physician and family physician. So I am employed by PCC, but specifically my role has been to translate services to West Suburban Hospital. Presently, right now, I spend several hours a day in the West Suburban emergency room. There have been days where, so they often see up to 8 to 12 non-fatal overdoses within a few hours. And so we don't have a social worker in the emergency room there. The hospital has not made that a priority. In addition, at this time, there's no peer support services. At this point in time, there's not been any funding to offer that service. So I'll just make that, I don't see really that happening in the next few months. It's very challenging. And I'll just kind of leave everyone with this. I had a patient yesterday who had a non-fatal overdose in the morning. The emergency room didn't declare this as a priority to consult me. And then the patient returned later in the day, having had a second overdose just by using a small amount of heroin, and then ended up in police custody. And so it was just, and then they decided to notify me. Very unfortunate situation. And so, you know, there are just numerous barriers that are taking place in this hospital. And overall, COVID is more of a priority right now, and understandably, because we have people just brought in, cardiac arrest, acute respiratory failure, and constantly the emergency room treatment teams are just pulled in to these rooms where people are just on the edge of death. And so it's been an uphill battle. I'm very, very thankful that I am there to offer services, but it's simply not enough. So we are just really brainstorming ideas. I think in the next month, we'll be able to actually implement a naloxone dispensing project right there from the emergency room, because we know nationwide, it's like 18% people actually go and fill a prescription. And it's probably even less in our Austin community. So, okay, thank you.
Thank you. And, you know, I passed a bill in the House to say that if there's someone overdoses, that they should be given Narcan upon their discharge. That bill is waiting to be passed in the Senate. Hopefully it will be passed in the Senate. The governor signs it. I think that the president of Loretto Hospital, did you want to speak about anything with as it relates to this, Mr. Miller?
I'll be glad to, and I certainly understand the frustration of the doctors. We do at Loretta have crisis workers in our ED to help assist, and so the crisis worker is everything. They're a social worker. They make the contact. They do intervene to give some a prior to this. I certainly hope that if the legislation you have, Representative Ford, will also have funding for the Narcan and the administration of that. But we have an expert on the line, Dr. Zafra. We'll be happy to continue working with all of us in this area because, quite frankly, people will go to West Suburban and then come to us in the same day or the next day or the following day. So it is something that all of us need to work on together, collaboratively and collectively, with Bobby Wright, with PCC, West Suburban, and the others, because it's a boomerang effect. We've got to get more resources. What the doctor expressed is frustration. There's just not enough resources to take care of the patients. Certainly, COVID is a high priority, but if someone overdoses, they could die. And we got to try to manage all of those issues. And part of it, unfortunately, is appropriate funding to provide all the services.
Thank you, Mr. President. Any other comments about COVID? I mean, about the substance use disorder and recommendations? Okay, no, going once. So I think that we have the ability to make a budget request and come up with, to work on a strategy, because we do have something established with the West Side Heroin Opioid Task Force. So Lee and Lou and we all will get together with all those interested in putting together a budget request and work on the strategies that we've been using for the West Side Heroin Task Force to enhance and broaden our reach and make sure that we can reach as many more people as possible. So once again, if you haven't put your contact information in for everyone, please add it to the chat. Also, the meeting is to make sure that we could come together with a comprehensive plan for the West Side. So we can take care of people as relates to COVID and health, and that includes behavioral health. And that's where we go from here. We go to Dr. Safir.
Good morning, everyone. Thank you for being on this call, and especially thank you for Dr. Huggett for laying the groundwork for much of our discussion this morning. I have a few issues that I want to bring to our attention. One is I think that there's a need for more high-level systems integration with regard to how we're approaching both the COVID situation and the opioid overdose epidemic. There are a lot of different entities working on the West Side who are focused on, for instance, issues related to the vaccine, for instance, West Side United, the Garfield Park Wellness Collaborative. At the Bobby Wright Center, we, for instance, have a grant to do crisis counseling for persons who have been affected by COVID. As you know, during this pandemic, there's been an increase in the number of suicides throughout Cook County and particularly on the West Side. I also think that, this raises the issue of an increased need for our street outreach efforts as it relates to substance use disorder. The West Side Heroin Opioid Task Force is doing a tremendous job with regard to street outreach and hitting those areas where we know that drug use is fairly rampant. One of the things that was not highlighted in the initial overview is that on the West Side, we know that those communities of North Lawndale, Austin, and East and West Garfield Park have been the hardest hit. But an interesting piece of information shows that 50+% of individuals who die from overdose deaths do so at their place of residence. And so our efforts have been focused on, catching people on the street. We need to find strategies for getting into these homes. Because if you're at home and there's a loved one available, or a partner who uses, a parent or a grandparent, we need to find a way to educate these individuals about the use of Narcan and ways to train them on how to administer Narcan within their own places of residence. I think that would have a huge impact on reducing the number of overdose deaths. I think that there's also a need for testing of the drugs that people are using. We know that fentanyl is one of the biggest drivers of overdose deaths, but there are other drugs that are being used to enhance the effects of opioids. There's one that's referred to as ISO that has been recently identified. And so as Lee talked about the need for overdose prevention sites, we could also integrate testing within those sites so that people have a place to go to test their drugs before using them, to find out exactly what it is they're ingesting. And so, I would offer that as a strategy moving forward. So the last comment I want to make is that, COVID is a stressor that, in my mind, is driving not only increase in drug use, but also contributing to the consequent overdose deaths and suicides on the West Side. So we need to look at these issues as integrated and not as separate, epidemics that are occurring. And we also need to find a way to utilize technology in order to improve communication and coordination of treatment. I heard a couple of anecdotes about someone going to West Suburban and then ending up at Loretto. Loretto probably doesn't know what treatment that person received at West Suburban, and vice versa. So we need a technology platform that allows all of us to be able to communicate, so that when someone shows up at Bobby Wright, we have the ability to go into the system to see where this individual has been, what kind of treatment they've received, what that response was, so that, we're not either providing inappropriate care, but certainly that it would enhance our ability to be more targeted and more specific with regard to the interventions that we use. And so that's what I have to offer this morning. Thank you.
Dr. Safir. And we'll take questions for Dr. Safir and as it relates to behavior and mental health. And we figure out how we could put together a strategy and a plan for this issue as well, and a budget request. But to your point about coordination, Dr. Huggett, you want to talk about the legislation that we've been working on with the department that the federal government has just approved to go at what Dr. Safir was talking about as relates to MAT?
Yes, thank you, Rep. Ford. Yeah, I think there are a couple of different areas that Rep. Ford has been working on. in particular to make sure that information is being shared. And I totally agree with you, Dr. Safir, that we need to be able to access, healthcare providers need to access those healthcare records. Not that they should not be shared without the patient's permission or anything like that. But one thing that Rep. Ford has introduced, House Bill 3889, will be having methadone clinics, opioid treatment programs, OTPs, report when they dispense methadone to the prescription drug monitoring program. This will be a game changer for us as providers to know when a person is receiving methadone at an OTP. Right now, we do not have that there's no requirement for methadone programs to report to the prescription drug monitoring program, though all other providers do. So this will be, this is moving along, and this will be one of the priority legislative pieces, I think, moving forward to help share information. I do also want to say that as part of the group that is taking care of folks experiencing homelessness during this coronavirus pandemic, we are working with Chicago Department of Public Health and trying to see how healthcare providers can better share information from hospital to hospital, clinic to clinic, emergency room to emergency room. So those very cases where a person goes from one place to another place, but no one knows what's going on. So those instances can be decreased or eliminated. So we're working very closely on that for interoperability for that. So those are two areas that are coming to mind. Was there another area, Rep. Ford, that you wanted to discuss?
Oh, that would be it. If anyone else, thank you, Dr. Huggett. If anyone have any comments about mental health and any suggestions how we can make sure that we coordinate our efforts with the Westside Behavioral Health Task Force, that would be great. And of course, yes, Leslie.
I just wanted to make a brief comment that while doing a budget request for the West Side, even data systems take a long time to get to the point where it could be truly integrated, and where, whatever the barriers are now to work through them all, it might be to our advantage. We're finding this out in deflection work that we do nationally, because I'm also the vice president of PTAC, is that the whole funding for care managers is critical so that it could link. So we might want to take a look at the possibility of funding for care managers or case management, defining what that is, and also, continued advocating for reimbursement for street outreach workers and care management as it pertains to substance use disorder, because that's the link.
Absolutely.
That's the link that I think is really critical.
That's great. Maybe the Westside Behavioral Health and Opioid Task Force can host a meeting with those interested in putting together a budget request, and that would be great. So I guess
I'd love to be part of that, sir.
So I think we will send out a notice so that we can host that meeting, so that we can have a strategy. The budget will be, we finished the budget in May. So we have time to get our budget request together and draft our legislation for all things that we need on the West Side. And if we stick together, we could make the request a reality. Any more questions on behavioral health right now?
Yeah.
Yes, President Miller.
Yeah, Rep. Ford, I don't know the answer to this, so I'll ask, but I really think it's a federal issue. But does the state have the capacity to require that all EMR have interoperability, that they will require to talk as a requirement, so that that's the problem of doing full integration. If a patient, they come to West Suburban, we don't know what they've done, if they're going to Bobby Rice. Before I asked the question, I thought about it's really a national effort. The federal government ought to mandate that any EMR company does full integration with another system. it's amazing to me. All of us have in our wallets right now an ATM card that we can go to any bank in the world and get our cash out of a local bank. But you can't do that in the city of Chicago if one person goes to one hospital and you can't get their medical information. That's part of the interoperability and the integration that needs to be taken care of that Dr. Zaffer and others have talked about. I don't know if the state has that power to require it, but if it can, that would be a huge piece to solving some of this problem.
Thank you, President. I think Dr. Huggett, you have a statement.
Yeah, thanks for that, CEO. I think that it varies from state to state. You know, like many of us, I'm reading President Obama's book, Promised Land, right now. Yeah, and part of the part of the healthcare reforms in Obamacare is specifically talked about electronic health records and interoperability, but we have a long ways to go before we reach that promised land. So I think that it does vary a little bit from state to state. Some states do require more interoperability, so this may be an opportunity for Illinois to take some leadership in that role. So yeah, that's a great question, though. I totally agree. We need to make sure. But we always have to maintain patient confidentiality and patient consent process.
Totally agree. Totally agree. Thank you.
Well, it sounds great. Dr. Huggett is my also volunteer health advisor, so I guess he will lead that charge to make sure that we could get policy on that if necessary. Work with the administration.
This is Ruchi Fitzgerald. I'm going to just pop in a little bit about that because I think for our most fragile and our most vulnerable populations, including those experiencing homelessness, this is where the system really breaks down, so for example, at West Suburban Hospital, we can often have people who are literally living in the emergency room for days. I presently have someone who is in the psychiatric room and she has been there for I am not joking. It has been 10 days that she has been there. So she was someone who came in and she has suicidal ideation. She tested positive for COVID. There's no psychiatric facility that is willing to take her with a positive COVID test. She is unable to go home. In addition, she is enrolled in a methadone program. And so this is where the system in Chicago truly breaks down. When I called her methadone program, they refused to speak to me without a release of information. And it was only because I'm a physician who is able to truly advocate through those barriers and say, I need to know what her methadone dose is and when she last dosed, so I can make sure she gets her methadone today so that she doesn't end up experiencing withdrawal, that I was able to confirm when she dosed and get her dose and get her methadone safely in the West Suburban emergency room. And then nobody bothered to order it going forward. So she missed a couple of doses. It has been truly challenging. She has been in the emergency room again for 10 days. And who knows what's going to happen to her, because she still tells me she's not safe to leave the emergency room. We've had numerous patients in this situation. They once had a patient there for 42 days in their emergency room. So I agree with Dr. Huggett that if we could have a registry of those who are most vulnerable, it would be amazing. In more resourced hospitals, they have in their EMR Care Everywhere. That's not the case in West Suburban Hospital. They just got an EMR and it's a pretty low resource EMR. It doesn't interface with the Illinois Prescription Drug Monitoring Program. Nobody checks the Illinois Prescription Drug Monitoring Program. So we really have an uphill battle. Even if we had that registry, I'm not sure who would take the time to check it from the emergency room side, because their whole goal is to see a patient and get them out the door. So.
Dr. Fitzgerald, just quickly, a safe haven here it's on the west side.
I know. Yeah. They wouldn't take her without a lockbox. So I ordered two from Amazon. And then by the time they arrived, she was so close to her 10 days. And so I also am the on-call addiction medicine doctor for a Safe Haven COVID unit.
Okay.
I help right there. I wrote their protocols for alcohol withdrawal and for opioid withdrawal. So they call me. And so when somebody goes into withdrawal, and then we register them with PCC. So that just was the issue there. She also felt really unsafe going to that area of town. So, we listen to our patients and we meet them right where they're at. And so, it's a really challenging situation. She actually wants to go to River Edge, just FYI. So I think that's going to be where she ends up going. But yeah, I know these are just anecdotes, but to me, they're real people. And I think to Dr. Huggett, they're real people too. So yeah.
So you have that information. I think that it's critical that you send us the information that you said in writing about those needs. You have my email. That would be fantastic if you could send that over.
Yeah.
Any more questions as it relates to substance use disorder and behavioral health before we go to the next?
I'm sorry, I don't mean to talk so much, but I just was saying, when we get to the point on any type of testing and the capacity for testing, free testing, nothing that would cost, or Medicaid, we can present. Ammon is a company that we only work with behavioral health providers. And so we're doing community education on, is a positive test really a positive test, and helping to define that. And then also the COVID testing, we're on the, we've been vetted by the Department of Public Health, and we're doing a lot of nursing homes here in Illinois, in Chicago and Southern Illinois. And we're tied right into the CDC and reporting. So I don't want to, when we get to that point, we're prepared to speak to that.
Okay.
And also community education.
Perfect. All right. Any more questions? This will be about testing, and it'll be about housing as well. I know that A Safe Haven was supposed to be on. I don't see them. Let's go right to
Rep. Ford.
Yes.
Can I just
yes.
Yeah, can I just say a couple of words? Ed Siderwitz from Catalyst Circle Rock and K. Ryan Center for the Arts. I just want the group to know that there are a couple of symposiums coming up that are rooted in the Austin's Quality of Life Plan. End of February is on housing. Right now, June is looking like on wellness and health and wellness. And also I want you to know that recently the K. Ryan Center for the Arts got a professional live streaming system installed. So if this can help in any way with the flow of information and education, please consider it for the use of the community.
And what does that mean? That means that they could come into your facility?
Absolutely. Absolutely. One, if you would like to be a part of one of the upcoming symposiums, just reach out to me, please. My info's in the chat. Two, the space is there for the use of the community. So we can stage a mini symposium, something on opioids, something on the needs that are being discussed here, that can be put out over YouTube, Facebook, whatever platforms we so choose. So I just want you to know there's a little symposium committee working on these next couple. We just had one on racial reconciliation last month. So housing in February, health and wellness in June. If you would like to be a part of it, if you would like to bring expertise and insight and community collaboration, we can weave all of this together in a way that could reach audiences that otherwise perhaps we never could.
Thank you. And Ed is an educator. Let's go right to Deborah Vines, because one group that we don't want to forget about are young people that are experiencing a new way of life, and that is the way they're learning. And Deborah is with the Answer Inc., and she could talk about the challenges that people with autism and maybe special needs are having with the COVID pandemic, and how we can help and what we should be asking for in the budget to deal with it. Deborah?
Good morning, everyone. Thank you, Rep. Ford, for allowing me to speak on this topic that I'm so passionate about. I'm Deborah Vines, the CEO of the Answer Incorporated Autism Awareness and Support Agency. And a lot of issues and challenges actually that are happening within our community as it relates to e-learning. Our children don't have the neural capacity to sit for long periods of time. A lot of them don't have a high executive functioning. So the e-learning is definitely not a good, it's definitely a barrier in this community. So what the Answer Incorporated is doing is we are offering tutoring services for these children and for the parents so that they can actually have different, I guess you would say, a way of helping their children to sit for longer periods of time and to be able to get them through this as well. And a lot of our children are missing the different therapies that they typically get with being in school. So we are asking some of our partners, community partners, to donate some of our services, such as some of their services, such as speech therapy, occupational therapy, behavior therapy, ABA therapy, because we don't have the funding to pay them.
Hello, Merry Christmas. Visit with Santa. We're driving through with Santa in Columbus Park. Hello, Representative Ford.
And
How you doing, Rep. Lily? Santa Claus had a breaking news announcement.
Okay, giving away toys. All right, and also we're asking our community partners to donate ABA services, speech therapy, occupational therapy, and behavior therapy, because a lot of the agencies that do offer free services, the lines are so long, the waiting lists are so long that the families, they're just going through crisis right now. And even as it relates to the parents, and I will be reaching out to the organization that said that they do have behavior counseling right now, because a lot of our parents that typically are able to send their special needs child, that, and I'm being very graphic and transparent right now, but a lot of them throw feces, bump their heads, self-mutilate. They have the opportunity to send them to school for those particular services. And now, not only are they dealing with that particular child, but they have other children in the household that they're dealing with as well. So a lot of our parents are actually going back into substance abuse. I was speaking to a parent last night, and she said, I'm drinking more wine than I normally drink. So we were able to refer her to a counselor so that she won't go over the edge and end up being an opioid patient at Loretto Hospital. So with that being said, I put my information in the chat, and what our ask is from Springfield is that you put more money into community groups like the Answer Incorporated that actually have boots to the ground, helping these families on a one-on-one basis, not just through COVID, but through life. And again, thank you, Rep. Ford, for allowing me to speak.
Very much, Deborah. And on the education part, we know that this is going to be the way of life now. It very well could be even next school year that students will be e-learning, and some parents may not even feel comfortable sending their kids back to traditional learning, and e-learning could become something that we have to learn how to support. So with that, any questions as relates to, we have educators on the line right now. I see Anita Hutchison on, they have a school. Any comments as relates to education where we should be putting together strategy to have in the budget for education, e-learning support for parents that need to have some possible support for their children while they have to go to work. Sometimes you just need someone sitting with the child, making sure that they start the computer and stay on task. So we should really be looking at budget requests for the community. I see Virgil I see him there, and they're doing that at Westside Health Authority. Is that right, Virgil?
Yes, sir, Rep. Ford, thank you. In fact, we are providing space for well over a dozen CPS students to do their e-learning. You know, the big support for the parents who, as you stated, in most cases, in a lot of cases, have jobs. And, you know, to have a place to send their children to do their e-learning and to have some support while they're doing it to help them get through it, you know, has really been a big help. But you know, it's a tumultuous task from my experience. You know, we're finding that there's just a huge deficit, you know, with our children. being able to, as the sister who was on a few minutes ago stated, to stay focused and to actually get through their schedule of classes and do their work throughout the day. You know, it requires almost hands-on the entire time they're there to get them through, just to concentrate on the work. And you know, there are a lot of other extenuating issues we've had to deal with and are having to deal with these students that involves behavior and just, you know, so it's a handful to say the least. And it's an area that's new to us, uh, certainly new to the children. And I think that you know, it requires um, you know, some very serious evaluating to try to figure out how we can put in place a model that actually work effectively, where it's going to benefit our children that are already seem to be starting from way behind, or are already way behind, and now being introduced to this technology as an intermediary between them and their teacher to just try to, you know, come up to average. You know, is, I don't know, you know, we have to come up with some ways and means to, I think, do a better job for our children who are having to learn this way now. And I'll say this last thing that, uh, you know, I think it's also a challenge for parents who, you know, those there are a lot of parents who are not at work, and whatever goes on in the home during the day, you know, in some homes, you know, they're all different, but we're finding that a lot of home parents are not uh, where they need to be, you know, to support their children uh, um, in this kind of a learning environment. So, you know, Rep. Ford, I don't have any answers. The only thing I can say is that, you know, we are experiencing some very serious uh, challenges with this e-learning and with our students. I don't know if we can actually see any progress in their learning at the end of the school session with the e-learning, but I think we really got to pause and evaluate seriously if this is going to be what's going to be used, you know, how we can make it work, how we can make it effective, and how we can make it beneficial for our children.
Yeah, there is no doubt, Virgil Crawford, that this is one of the things that issues that we should be focusing on, because we already know that our kids, the children, struggle on the west side of Chicago for a lot of different reasons. So we will be doing our young people a great disservice if we don't have a plan for them as it relates to education. So I know that we have Ms. Humphrey and we have Anita Hutcherson and Fair and Ruth Kimball. These are all people that are work together that I believe that we could work together with. It's not Westside Health Authority. It's what group that you have?
Our e-learning space is provided by a faith-based group called Every Block of Village Christian Community Center.
Okay, so
we're located at, I'm sorry, we're located at 5834 West Augusta Boulevard.
And hopefully you put that in the chat. We're gonna, we definitely have to have a strategy for education, and not only making sure that young people have the capacity to e-learn, but also have the support to e-learn, and making sure that they are, you know, achieving the goals that are set out. Otherwise, they're going to be behind even more, and we're going to lose them. And they will not return to school. So hopefully we will work together with this group to put together our strategy and plan for education. Thank you so very much.
Representative Harrison, can I add to that?
Yeah.
I just want to piggyback a little bit on what Mr. Crawford was saying. I mean, to that, one of the things that I really believe we must not miss in education are those soft skills that our kids will apparently struggle with in games, our essential workers struggling with, you know, skills like problem solving and leadership skills. And, you know, part of why many of our families can't facilitate or navigate what's happening right now is a lack of flexibility and adaptability. And so some of those skills that we must have to do all of this work, teaching, making sure that our communities are prepared to educate folks around Narcan, all those things are supported by really core, good, strong soft skills. So I want to make sure that we are adding that component to our educational ask.
I appreciate that.
And Rep 4, this is Val McLeod with Healthy Place Now. I am, just delighted to see everyone that's here in this community collaboration. And let me thank you for your leadership and representation, sir, in serving the West Side. We're going to share a little bit more, but I just want to interject now. I was in a conversation not long ago with Dr. Arthur C. Evans. He's the CEO of the American Psychological Association. And we're talking about exactly this current focus is how this COVID dynamic has just caused a trauma upon children, and how we must now begin to really prepare for when they go back to school and begin to put in systems for that recovery and the mitigating things that we can do. So imagine, I think someone just shared, perhaps Deborah, that there were children and families who were already in very, very sensitive situations. Now all children are in it. And so how do they recover after their recovery? And I was asking Dr. Evans about just preparing for what funding should look like. And he is very much on board. So just consider those educators reaching out to the American Psychological Association, because they're applying for grants now and just really expressing their needs. We were already having too few social workers, too few counselors. So all those lines need to be started to be built up right now, because we're really going to have to be able to stand in there for our children in an even greater measure, because right now we're doing so many on the ground right now things that's important, but sometimes those tangential things, and far too often our children, sometimes we don't realize what the impact they're having, because they can't express it until so many years later. And I know that this coalition that you built here can be on the cutting edge of putting strategies in place for that. I just want to interject that for a moment. Thank you.
Thank you, Val, and I look forward to hearing from Dr. Banks soon. I do believe, I repeat, I do believe that if we put together our strategy and our plan and budget requests, we can achieve our goal. So this meeting is about making sure that we have a plan, a strategy, and a request for the budget. And if we stick together, that will happen.
Representative Ford.
Yes.
If I may just interject, as we were talking about the opioid epidemic, in our community, in fact, we have pandemics within our community. And I'm happy to hear that, a task force is in place to deal with that, and to come up with policies that can bring the resources that we need. I think, that same kind of diligence and strategic forward thinking should be, we should think about establishing that for our schools, for our children, especially around the e-learning. I think we actually need a structure, a community structure that would allow educators and community leaders, those who are involved with kids doing the e-learning, to come together outside of this platform to, really discuss what kind of strategies, what kind of plans, what kind of support we need to make this thing work for our children. As you stated yourself, this is going to be around for a while. So, we cannot just, haphazardly deal with it and thinking that it's going to return to normal. So I'd like to just suggest a real structure be established for that.
Thank you. I agree. And I think that we have the team of people that's really looking forward to put that together with Ms. Kimball, Humphrey, and Fair, and also Hutchison, and anyone else, Ed. We have, I see Sharon Morgan on, all the educators. And if there are any others, we definitely should make sure that we come together soon to put together our plan and budget. And of course, there are a lot of homeless also. Yes.
Yes, I'd like to add that I think there's a need, particularly in these e-learning situations where you're really seeing children who are distracted, who are difficult to, stay on task.
Yep.
That we need to understand that, children may have anxieties related to COVID. They leave home in the morning and, their thought process is, am I going to get infected with this virus? There's also the issue of trauma, that many of the behaviors that you're probably seeing may be related to the fact that these children have been exposed to trauma within their communities, and that's not been dealt with. And so, what you see is, lack of emotional regulation, difficulties concentrating, etc., that may be symptomatic of trauma exposure. So I think that we need to integrate behavioral health, mental health into these environments so that you have a resource there to help you understand what you're seeing in children and where support can also be provided. So, a social worker or, a counselor who can not only provide some individual support for the child, but that can also provide some support for the teachers and for the families, as they deal with this situation. So, I think that, we need to find a way to make those linkages so that any organization that is having an issue with children know that there's a resource available and that there's an easy way to access that resource. It to some extent doubles back to this issue of technology. You should be able to, go into the system and find out what resources are available and to be able to easily access those resources and not, be wondering around about who's, available to provide this, that, or the other. So again, I'm just thinking that as we think about, moving this budget forward, we not only need to think about the interoperability between the hospitals, but also how hospitals can communicate with community-based organizations and how those community-based organizations that are providing, specialized services can access resources, that are available within the community.
Okay. Thank you. And Dr. Safir, and everyone knows that even before the pandemic, schools and places where people are being educated struggle with having behavioral health support. And
right.
So now this is a great time, as Crawford, Virgil Crawford and you are saying, that we have to step up and make sure that this is a priority because, even if we put all the resources in education and students are not ready to learn because of their mental health, it's not going to be successful. They have to be ready. Thank you so very much. And let's go to, I see the hands raised and they are in this order. Sister Ya, Hannah Kaufman, Dr. Fitzgerald, and I saw Banks raised her hand now. Okay, so Sister Ya, I think that we are about to embark on the vaccine. And there's stigma to the vaccine, and there are, I think that people are questioning whether or not they should take it. it's not my position to tell anybody that they should take it, but what is important is that people understand about the vaccine. Um, and
Yes,
Sister
sir.
Guy is an epidemiologist, and will you please move forward?
Yes, sir. Again, thank you so much for inviting me to this, Representative La Shawn Ford. And more importantly, you all, thank you all for, I hate to pivot from that very serious conversation about our young people and learning. And I just have to report that my daughter is actually an online teacher. So she's experiencing what you all are talking about from her own students. And she's teaching second graders and sixth graders online, and the difficulty, even with the ones who are up to par. So, you know, we are experiencing this new wave of learning in a whole nother context. However, I am Sister Ya Simpson, your favorite community epidemiologist, and I'm going to pivot a little bit. My reason for being on your call today, as you all embark in talking about policies as it relates to substance abuse and, of course, mental illness and homelessness. Yes, I'm going to be the one that talks a little bit more about COVID because it just so happened I do work for the local health department, but I am here representing TACS, the Association of Clinical Trial Services. That's the organization of which I belong to as the community epidemiologist, and we bring science to the people. My announcement today really was about to get the facts of what happened with the Pfizer, and it's only Pfizer that went to the Vaccine and Related Biological Products Advisory Committee. That is the committee that where they get the approval, if you will, or is it favorable that if your vaccine is considered safe, tolerable, and more importantly, able to move forward for an emergency use application. That's where you keep seeing EUA. It's not for Europe. It's for emergency. I was like, Europe, what is that? But I guess, you know, it looks like that acronym. But the point of it is I wanted to let you all know of the 22 people who is on that committee. They had to vote on, based on the totality of the scientific evidence that was presented December 10th, and it was a lot of scientific evidence for more than 4 or 5 hours, due to the benefits of the Pfizer BioNTech COVID-19 vaccine, do they outweigh the risk for the use in individuals 16 years of age and older? The reason that I'm reading that is because I need people to recognize this was not to vote of should you use the vaccine or not. It was to say of the scientific evidence, does the benefits of the Pfizer vaccine outweigh the risk in people who are 16 years or older? Now, let me be clear. The vote was 77% yes, 18%, which is 4 people that said no, and we have a person that abstained. I am a person who was part of a task force with the Nation of Islam COVID-19 task force, where we monitor the entire proceedings from 9 o'clock to 4 o'clock our time. I specifically listened in on the epidemiology, and I specifically listened in on the voting questions. What I want you all to recognize is that it was considered favorable that Pfizer did provide enough scientific evidence that this vaccine is considered safe based on the people that they have been observing since about October. Now, the data ends in November 14th, so anything else that has occurred since November 14th would not have been presented. Let me be clear to you all that I, as in tax, do not tell people to take a vaccine or not take a vaccine. We do not have an opinion to say, yes, you have to take it, or no, you don't have to take it. Our opinion is please know the pros and cons for your individual self, know what the facts are for all the science that's involved, and then make a COVID plan, because whether you take this vaccine or not, as I think it was it who was it, Dr. Hutchinson or someone who presented earlier on the coronavirus. That's when I thought I was going to be speaking, because then it would have lined up, but that's okay. That's the way things go. But here in Chicago, for the for the people that are infected, plus the people who are not infected, everybody has to think about if you're going to take a vaccine or not. We do not have a position of yes or no. We have a position that says we need more data, and Pfizer said that they will be providing more data for the next 24 months. This trial is a phase 2, 1, 2, and 3 trial, actually. What that means is that they're up to phase 3, meaning that they can open it up to further people to be in it. Now, let me be clear. Pfizer is not, United States is not the only place that Pfizer has this vaccine. So you will hear about, Brazil and Australia and other places. But the point that we focused on, obviously, was how was the trial being conducted here in the United States, and how people were doing well with, in taking that vaccine. There are more people in the placebo arm than there is in the vaccine arm, but unfortunately, that's the way it works out. Consider the word, and I need you all, if you don't already know, you need to know the word vaccine efficacy, which means how well does the vaccine work in a population where there are lots of people who are getting in this case, COVID. And in Chicago is a place to do a trial on, because there is enough people who have unfortunately contracted COVID-19. But I also want to give some, if we can have encouraging notes, that people are surviving. So right now, in the city of Chicago, I should say, for the amount of people who have contracted COVID-19, 170,000 or so, is less than 3% that have actually died. But that's not always just about death. And I really want to be clear, as an epidemiologist, we use death as an endpoint. Unfortunately, we have to count it, but we really want to talk about survival rates. And people are surviving this disease without understanding all the treatment. There is no standardized treatment to COVID at this point in time, not standardized, whereas the treatment is more. And so I want to talk and clearly state, one of the things I want you to advocate is better treatment along with vaccines, along with testing. So testing, treatment, vaccines, and prevention is always public health, you all. And what my real message to you is that we have to not just focus on vaccine. We need a COVID-19 plan. I know Representative Ford has been involved. He put out a paper, or a opinion about us on the West Side, and I appreciate it. I read it, by the way, Rep. Ford, and I appreciate that he's not telling people we have to take it. He's not telling people not to take it. What he's saying is, no matter what, he doesn't want his West Side constituents to not be involved or have the opportunity. If that opportunity arises to take it, you should be able to have the choice once that choice is given to you. Now, let me tell you now, you will not have that choice this year. Nobody will get the choice to take that vaccine this year, because it's going to be only for healthcare workers and people that work in long-term health facilities or long-term nursing home facilities. So as a person, if you don't work in those two environments, you will not have the opportunity this year. That will be discussed for next year, and it's going to be done in such a way, if you were familiar with the flu shot the flu epidemic, because this is not our only epidemic, this is a pandemic, but the point of it being is that it's going to be done through appointments, through what we're calling a place of dispensary, a pod area. And so you will not be able to just walk in and say, give me the vaccine. But I also have to tell people it is going to be a process. The Chicago Department of Public Health is at the point of the process for vaccine dissemination, and it will be overkill. I don't like that word, I'm sorry. trauma informed. It will be a plethora of information of who's going to be allowed to come in and get the first dosage. So Pfizer is only is a 2-dosage approach. Moderna is a two-dose approach. And I just have to make sure that we are bringing the science to the people. That's what tax is all about. And I would want to support all of you all, you know, in my consulting role, not just as the health department, but as tax, to help you all with the science. And more importantly, if you're applying for certain types of grant that need the data, that's where I would be of assistance to you. So I hope if you have any more specific questions about the actual what happened with the FDA approval, because they said they are favorable. It will now move. CDC already said they're favorable, and that's because they have not seen the type of adverse effects that would stop the vaccine from moving from emergency use to licensed use. And right now they're only applying for emergency use. So if anyone has specific questions on what happened with that meeting, I have notes, very copious notes from my team that I work with, the Nation of Islam COVID team. We took on this task, and we will be taking on the Moderna meeting as well. So thank you, Rep. Ford, for allowing me to all I wanted to do was give an announcement to this, and if people needed more understanding, I would be available for that. But I don't want to take up a lot of time with your call, because you all are really focused on the strategics of getting policy done so you can get funded. And I get that. But
well, you know what, Sister Yah, I think that there must be some funding for understanding and educating. And so your messaging is important. And I think that this pandemic should wake us up, because I think that the Loretta Hospital is going to be doing some trials, clinical trials. And you speak about clinical trials all the time. There should be funding in place for us to deal with clinical trials, bring more clinical trials into the west side of Chicago, so that people have a better understanding, so that when we get to this point, you know, you want to tell us why it's so important for Black people to be included in clinical trials? I know we're going to try to close out in 30 minutes or so, and I thank everyone for sticking with us. Everyone will have their opportunity, and this will continue. Go ahead. Did you want to talk about clinical?
Yes. So very succinctly, because I do want to get other people their time as well, but very succinctly, the reason that you want diversity in clinical trials. So we're going to reverse it and say diversity in clinical trials, which includes having Blacks in it. Now, I will be the first person to tell you how malevolent this healthcare system is to us. It has not been our friend. It is not built to protect us. It has not been the way that we have had the best outcomes. But yet we're in this country. We ourselves have been the best participators and innovators of this healthcare system. So as much as it cannot be for us, it can't always be against us, because we have been contributors to this healthcare system in the right way, the righteous way. The reason you even have a polio vaccine, that vaccine by Jonas Stock was created from the HeLa cells, which came from Henrietta Lacks's body. So don't tell me we can't heal the world, honey. We can do it, but we want things in right order. That's what Black people said. We're not saying that we don't want to participate in any other things, clinical trials, vaccine trials. Black people have to just have balance. We don't want to be exploited. We don't want to be the only ones that's the last ones. And even if we're guinea pigs, we want to be told that we're going to be guinea pigs. We just want fair process, transparency, and parity. Just like Moderna is a biotech company, we want Black biotech companies. Just like we got Pfizer as a pharmaceutical company, where's our Black pharmaceutical companies? So the point of clinical trials is not to say not to be involved. The point of clinical trials is to say that we want to be in the process fairly and equitably. Health equity is our process. So diversity in clinical trials is a must, because if we don't know how it works, and just for example, in the Pfizer trial, there's about 10% people that are Black, up to, it's about 9.9, but about 10% people who are Black that is in that trial. Now, which arm are they in? Are they in the placebo, or are they in the vaccine? We do not know that. Is not unblinded. but we do think they have to, and the FDA told them, they have to start making sure, they use the word minority, I'm minor to nobody, but what they were saying was, make sure that you get more Black and brown and Native Americans in these trials, and women, and they want some more 16-year-olds and 17-year-olds to participate. Because right now, even though it's 10% Black, that's based on a number that could be from around the world. It could, we don't know if all these Black people from the United States, is my point. So they have to include more Blacks in this trial. And they said they would. My point is that if we don't know how well the vaccine works and on all people, then you still are losing sight of what the purpose of the vaccine is, which is to protect. It is a protection vaccine.
Yes.
It is not a treatment vaccine.
So thank you so very much.
That's why we should be in clinical trials. I'm sorry if I get a little specific.
No problem. I think President Miller had a statement to make about clinical trials.
Yes, and just to echo what Sister Yara said, we do. We are, we deliver at a hospital. We are FDA approved to do double-blind clinical trials. And the one reason we want to do that is just the reason she outlined. We want to make sure African Americans were participating in clinical trials. We have been approved to do 3 COVID clinical trials from 3 different national companies. One of the companies is waiting to get approval, so I can't speak on their name, but they had over 500 applicants across the United States, and they chose 5, and we were one of the 5. So right here in Chicago, our whole goal, and we want to spread that message, is to do exactly what she described and make sure African Americans are part of the clinical trials. I'm the first African American CEO in the 90-year history of Dealing with a Hospital, and one of the things I brought to the platform is this is something we're going to be in. We do medical research. We have 6 other clinical trials going on right now. We have board certified physicians in charge of those clinical trials, and we want to spread the word. We need a large number of African Americans to sign up and participate. You'll get free health care. All of the medicines and the diagnostic testing that we've done will be free. You will be paid, and you'll have healthcare for 2 years, because the studies do take a long period of time. So we're very honored and pleased that we're FDA approved to do double-blind clinical trials and 3 different vaccination trials for COVID. We've got to be part of the solution. And my commitment to everyone is we'll be treated equitably and fairly. We'll be on both sides of the study, both the placebo side and getting the actual drugs. I don't know who will be, but I've made the commitment to be assured that we'll be on both sides of the test. So we're very honored and pleased. Thanks, Rep. Ford.
Thank you, President Miller. And are there any statements about this before we? I know the press had some questions, and we're going to go to the press then. I want to thank all those that got their hands raised for being patient. Any questions about the clinical trials and what Sister Ya, the epidemiologist, had to say? Pat, I think you were muting yourself and unmuting. Pat, did you want to say something?
I'm going to be up next with Hannah with the legal issues. So I was just getting ready.
All right, that's good. That's good. All right. So the press wanted to ask some questions. Did you want to go right now and ask your question, Zach?
Yeah, please. I've got a couple, 3. That's all right. So first one, I'd like to cycle back around to the CPS stuff. Do we know a percentage of households on the West Side that have reliable internet connectivity? Are students? Is there an issue of students not having that connectivity or not having resources like computers to complete their schoolwork?
I know Virgil might have an answer to that.
Well, what we do know is, and have learned, is that the CPS supposedly have equipped students' homes with internet accessibility. Now, regarding the actual hardware, the computers themselves, we're running into a problem where a lot of students have computers that are not functioning right, not working. So, we spent quite a bit of time traveling back between the school and the e-learning location on Augusta to get, good computers or working computers, and laptops are what they're using. And you know, that's time consuming because all of these students are not necessarily from the same school. So if you can imagine, we have 15 kids there, and 12 are from 12 different schools. You know, it become quite a task. But yeah, so they do have internet accessibility at home, and you know, for the most part, we have computers as well.
Okay, thank you. And then moving back to the vaccines, for you in particular, Representative Ford, is there anything being looked at the state level to ensure that that vaccine distribution is truly equitable?
You know, I would say that we're working on a plan, and this group will make sure that it's equitable for the west side of Chicago. That's our strategy here today, Zach, to make sure that we have all of the organizations on the west side are making sure that we have our demands and that the state of Illinois understand our need. So we will have a strategy and a plan and a request in the hands of the Illinois Department of Public Health. And
And I
Dr.
think
Huggett had a
that's
statement.
important. I want to jump in on this a little bit because Illinois Department of Public Health is where the state level. So yes, LaShawn, that is absolutely on par. But let me be clear: vaccine distribution in Chicago is done through the Chicago Department of Public Health. And let me address what you are asking. You just want to make sure that everybody who wants the opportunity to have the vaccine can get that opportunity. And you want everybody to have that opportunity. That's what we mean by equitable. But let me be clear, they're also going to follow the science of who are the higher risk groups first versus risk groups that may not be in the same predicament. Let me be clear. The vaccine will only be given out for this year and the first part of next year to healthcare workers first and to people who work in the long-term health facilities and those nursing homes as well. So people in the nursing homes who are patients, people who work in the nursing homes that are patient will be among the first to get them, and then the healthcare workers. Now, once those two groups have been addressed, if you will, given the opportunity to get the vaccine. It's an opportunity because there is no mandate that you have to take it. But given that opportunity, once that is done, the approach to having people take it on the bigger scale, the public scale, will be done by invitation through the POD, which is point of disbursement. That means it's going to do like if you live in a certain area, it's going to be done that kind of way based on where some of the sites are going to be set up. So is it going to be an opportunity for fairness? Absolutely, for those who want it. But I want you all to always go to the city of Chicago. Earlier you saw where the coronavirus update, you can just go to City of Chicago Health Department. They're going to tell you how this works. There will be announcements for the people that they're going to be bringing in. It will be invite only because there's going to be such a intensity around people who want to get it. They want to make sure that it's done in a fair, equitable way. And it's because it's 2 doses, so they have to follow you in a certain surveillance approach. So it can't just be willy-nilly because they have to know when you got your first dose versus when you get your second dose. And the second dose is where the most efficacy comes from with the Pfizer. So
Illinois did have to present.
I'm glad there is a plan already in place for that.
Right.
And then while I've got you,
Dr. Huggett had, Zach, before you, I think Dr. Huggett had a statement about that also.
Of course.
Yes, thank you, Rep. Ford. I'd just like to piggyback on what Sister Yas said, and we're talking about the phase 1, and that's what happens after the healthcare workers who are in direct contact with people who have COVID-19 disease and the long-term care facilities. In phase 1C includes folks experiencing homelessness who are in high-risk categories. And then in phase 2, this is according to CDPH, the medical director for immunizations, Dr. Friccioni. In phase 2 will be community equity based. So that phase 2 is where where our advocacy really comes in, and especially since the West Side and Black and Latinx communities have been so hard hit, that's where our advocacy can really come in that phase 2. But I agree with Sister that it'll probably be some weeks before we hit that phase 2. But the phase 1 does include people experiencing homelessness who are at high risk.
Thank you, Dr. Huggy. Questions, Zach?
Yeah, and then just a final thing from me, mostly directed toward Sister Ya, but if we have anyone else with expertise, please feel free to add. What specific concerns are there with the fact that this vaccine has been developed so quickly? A previous record was 4 years from mumps, and now we're a year or under with this. Are there concerns that things might have been missed? Are there concerns that there might be side effects or results that we don't know are going to happen or could develop?
Okay, thank you, Zach. Those are excellent questions. So first and foremost, what's new is new to us. They have actually been working on this vaccine since 2019. When China first learned about this SARS version 2, they actually sent the DNA code to many countries around the world. And with that DNA code, many different countries, including the US, started working on well, they actually was just working on what is it? And then they was working on the DNA of it. And then of course, we talk about treatment and vaccines. You know, we say vaccines, but they were technically looking at what treatment can be. So the point of it is they were looking at this DNA coding since 2019. So it is not new. Moderna has been working on mRNA approaches to many types of illness since about the last 5 years. So that's the first thing. The second thing is they did not, Pfizer in this specific, in Moderna, have not skipped any of the steps that are required by the FDA to get an emergency use application. They took every step. Now, what did happen is because it's emergency room use and it's because it's a pandemic, the speediness of it came in the bureaucracy, where you're not waiting for your paperwork to get signed off by a clerk somewhere. So what you do see is that government can work when it wants to. So they got things done in a manner that was considered fast paced because of the emergency, and of course because this is a pandemic. So no steps for the safety and tolerability were skipped. Now I will also leave you with the last question. How safe is it, given that they've, technically only looked at 170 people? You all don't know that, but I have to tell you the truth. Given that the safety has been considered favorable and beneficial going forward, Pfizer still has to stay in the phase 3 study for the next 24 months. So they will still be monitoring for safety and tolerability. Just because it's going to be given out to people, that in itself is going to be reviewed as almost tangent to the trial. So you not only get people in the study, now we're going to have actual application of the vaccine, and that will be monitored for safety as well.
Yeah, that's great.
Thank you so much.
I think that we have a very, very skilled West Side people. Thank you, Sister Ya. You are my favorite epidemiologist.
Thank you.
Dr. Huggy,
You're my favorite state rep.
anyone else to the point?
Yeah, I just wanted to say, just to reemphasize that this is an emergency use authorization. So that's why it's not going to be like a required immunization, as Sister Ya so clearly stated. So, so right now, healthcare organizations can require, like I'm required to get a flu shot where I work, but this will not be required because it's an emergency use authorization. After it's more established, then there may be that requirement. But I think that Sister Ya is exactly right. But we also have to realize that over 3,000 people have died of coronavirus in Chicago, that this is a deadly disease. It also puts people out of commission for, sometimes for some weeks. I certainly have known patients of mine that have died of coronavirus, certainly family members of patients. So I think that it is a serious thing, and we always have to weigh the pluses and the minuses. 95% effectiveness is something that's really notable, though. Thank you, Rep.
Thank you. Any more questions from the press?
Rep Ford, I just, if I may real quick ask Sister Ya, in the stages, post-market, I guess what they call post-market surveillance, is that something that we need to think about or has taken place, or is it too early for that?
So the answer to your question succinctly is yes, they will be doing surveillance. In fact, the health department has to do surveillance on any, ailments such as like a COVID-19. So what you really are asking is Pfizer, this is what you're really asking. You're saying Pfizer, are you all going to still be looking at how well this vaccine, even though we say a 95% effective, there's some caveats in there, but nevertheless, the public knows 95, and we'll stick with that. But you really want to know, will they still have to follow this after they give out this vaccine? And the answer is that yes, they have to. It's not an option, because remember, this is emergency use. They still want to get labeling, licensing use. Licensing use is another process, and they will have to present data to also say, can I get this as a license, not just as an emergency? So the answer to your question is the next 24 months, Pfizer has committed with the FDA. I was on the call where they committed 24 months from now, they will still be monitoring the safety, the tolerability, and the vaccine efficacy that they have now for their product, put out with their product, which is the vaccine.
Thank you.
And will Moderna be making that same commitment?
More, I can't say, because Moderna's meeting is next week. I'll be on that one too. But, suffice it to say, it would not be in their benefit not to say it. And they want to benefit. So they're probably going to say the same thing. But let me just be clear. Moderna's time is going to be next week, I think on the 17th. And then I can come back with a report on that as well. But more than likely, no company, and including the other 6, AstraZeneca, Johnson & Johnson, nobody asks for it to come out and not say that they won't continue to monitor, because this mode of technology for a vaccine is brand new on the planet. So everybody's going to be monitoring it.
If I could just add that all companies have to commit for 2 years. All the studies that are being done will be a 2-year study for the very reason you outlined. The reason that it is being done now is because it's emergency use of the virus. But you're supposed to have 2 years of clinical study with all of the data and at least 300 folks in the clinical trials at the third phase, 50 in the first phase, 200 in the second phase, and at least 300 in the third phase. So you're correct. Everyone will have to do two years. All of our studies are 2 years required by the FDA.
Thank you. We know that there are problems with the legal system with people as it relates to COVID, evictions, and all sorts of challenges that people may have as it relates to COVID, homelessness, etc. So I think Attorney Kaufman.
Yes.
And then we go right to Banks, and then we go to Harrison. Thank you.
Perfect. Thank you so much, Rep. Ford, and for all of you for letting us be a part of this conversation, which is dispiriting in some ways, but has so much hope in it in others. So as Rep. Ford said, we're going to be talking to you a little bit about some of the legal issues associated with COVID-19. So I'm Hannah Kaufman. I work with the Lawyers Trust Fund of Illinois, which is a nonprofit foundation that funds free legal services throughout the state. And Pat, do you want to introduce yourself and do a very quick run through here?
Yes, I do. Thanks, Hannah. And thank you, Representative Ford, for letting Hannah and I be part of this really important conversation. I am the legal director of Carpel's Legal Aid. We run Cook County's Legal Aid Hotline and 4 court-based help desks at the Daly Center. I am one of 450 legal aid lawyers around the state of Illinois. And even in good times, there was more demand for legal services than our system is able to provide. Of course, COVID has not made that any better. There are many things that happen when you have a health crisis, and the first one is interruption of employment and income. And that leads into a cascade of financial problems that cascades into a bunch of defaults on your contractual obligations, such as mortgages, leases, and debt. Also, with COVID-19, it being a health problem, people are confronted with issues of probate, healthcare directives, guardianship of children. So a lot of things have happened already in the pandemic, but it isn't as bad as it's going to get. We feel we're facing a legal tsunami coming our way, and that's because the hand of the courts has held off on litigation. The most exigent things that happen to people are being evicted, having their house foreclosed, dealing with debt collection that causes wage garnishment and bank freezes. So those are all very much emergency situations, and those have all been on hold. We know there have been these moratoria that are expiring, have expired, maybe have been extended a little bit thanks to the governor last night to January, I think it's the 9th. So a lot is going on right now in the legal community, but one thing that's been great is this crisis has brought opportunity for collaboration and coordination. And this is a great little visual just showing all the different legal aid programs that we have here in Chicago and then beyond the rest of the state. And we've come together as a community to try to find a way to onboard all of the people who are having legal problems because it's even a greater demand for our services than we've had. So we've invented one tool that I'd like to tell you about among quite a few new programs that are happening. It's called COVID Help Illinois. And the HELP stands for Housing and Economic Loss Prevention. And the whole point of this is to have a place online where anyone in Illinois can go who are having problems, these legal problems that are caused by the pandemic. So 24/7, it's free. This is all put together by legal aid professionals. And this website is a place to interact with virtual legal assistants, or really what are chat bots. They've been programmed by legal aid lawyers for an interactive conversation in the areas of employment and unemployment, housing, which includes landlord-tenant issues, eviction, and foreclosure, personal debt and bankruptcy, and then finally probate, so which that's wills, estates, guardianships. So the website, covidhelpillinois.org, has this great suite of chatbots, these virtual assistants. We tried to make it very user-friendly and approachable because people having legal problems are always, stressed out, and we wanted to make this something that people could find very accessible. So Hannah, I think, is going to show us just a very quick little demo at this website. So it's covidhelpillinois.org. What we're hoping is that some of your organizations might be able to link to this. You might be able to tell people about it as they come in and use your services. So take it away, Hannah.
Excellent. Thank you so much, Pat. And so when you go to covidhelpillinois.org, just give me a thumbs up if you can see my screen. Excellent. Yep. Okay, cool. So this is the website you arrive at, and you can go through the tabs at the top to find out more about how it was created and who's behind it, as Pat alluded to. You're going to see lots of buttons and options. There's over 200 different paths that people can go down that legal experts have designed, and it's all free, available 24/7. Here's the introduction. I'm going to click Let's Chat, and I'll just take you through the absolute quickest version. Let's say somebody is having trouble because they had COVID and they're now struggling.
Okay. Hey, Heather, did you see that the city's gonna? Yeah.
I sent it over to Dr. Ali.
Oh,
okay. I think I copied. Yeah.
I wasn't sure if that was for me.
No. No, that's to get the vaccination. No, I'm talking about the vaccination. The city contacted me.
Yeah, I forwarded that over to Bonnie in the PR team.
Okay, wait, no. That's confidential information. No.
No, because we're supposed to share with Bonnie and them when the stuff arrives.
Heather.
Hi, can you hear me?
Yeah, we can hear you.
Just in time. Sorry about that. Okay, so it is statewide. I know we're talking about the West Side today, and there's definitely plenty of resources available here for the West Side and Chicago and Cook County more broadly, but there are also throughout the state as well. And so you enter your zip code to get started, and that's so that it can get you to the best possible resource of these free legal services. So I entered my zip code. It says, you're in Illinois. Here are the different categories it can help with. So let's say, again, I'm having trouble paying my medical bills. So I click money and debt. It introduces me to the virtual assistant, Connie, who helps with these issues. And then you can select lots of options. But in this case, I'm going to select, I can't pay my bills. It says what type of bill. And I'm going to go with the second option. I can't pay my medical bills. It provides lots of information, and we've tried to break it into small chunks. I'm not going to go through it now, but I encourage you to take a look at on your own time. If you click I need more help, it will give you, in addition to that information, some legal referrals, all for free legal services. So it's going to ask me if I'm a veteran. That's to screen me for a particular service, but in this case, I'll say I'm not. If I wanted to speak with an attorney, I could click that button and it would refer me to whatever free legal assistance is in my area. In this case, because I've entered an Austin zip code in Cook County, it's going to refer me to Carpals, which is Pat's organization. And there's a link that's hyperlinked for people who are using this on a mobile device. So you can call Carpals, you'll get through to an attorney, and it lets you know that you might have to wait a little bit of time to set your expectations. If you want more information online, you can click there and it will take you to the largest statewide website that provides free legal information, Illinois Legal Aid Online. And you can click there and it will open up a new tab all about medical debt specifically. So that is kept up to date as well. If you say you're all done, you can rate it, give a little information. It will ask if you wanted to provide more information. I'm going to say no. And then you're always welcome to share, spread the word so that other folks can get help here. So we just wanted to do a very quick, quick overview of this new free resource that just launched on December 1st, rather. And what we're really hoping for is that you can help people get access to this because it is free, but people have to know about it to use it. So you can link to it on your website or newsletter. We can even help you put a little widget on the side of your website so that you don't have to maintain anything, but it just shows up to help people. You can use COVID Help yourself to walk people through a conversation if they're having trouble with something. Post flyers in e-learning centers like we've talked about a little bit today, and I'll post a one-page flyer in the chat after this. You can follow COVID Help IL on Facebook and Twitter to help spread the word, write an article, or we're happy to do any demonstrations. Our contact information is here, and again, just thank you so much for letting us be a part of this.
Thank you so very much. Any questions? If not, we go right to Dr. Banks. And I'm very happy that Dr. Banks, they are a private entity that want to help with nonprofits and provide nonprofits with support and partner with nonprofits in the community. So thank you, Dr. Banks, for your patience and being here with us today.
Thank you. Thank you so much. Thank you everyone for participating. This is really a godsend for the community, for us individually, and us as professionals. I am on a very special mission with a company called Healthy Place Botanicals. And what we do, we represent the natural side of supporting your body and your body's needs. So what we like to kind of see is more connectivity between the medicine world mental world of making better choices with what we eat, as well as choosing like essential oils to be supportive of our immune system. So that's what our 24/7 message is. And we'd like to help educate nonprofit foundations. We'd like to help provide fundraisers so that they can become more empowered to get their messages over. So we have like a silk mask that we provide to nonprofits, as well as we provided it to you, Rep. La Shawn, for your district. And we loved it. We gave out hundreds of very exclusive silk masks that will help protect us. But it goes further than that. It goes to everything that I've heard spoken about today. Dr. George Miller, I'm assuming a doctor, thank you so much for your presence, because you as a president of a hospital is in such a pivotal position right now, because you need help, but you can also provide help. But I would like to ask that you, if you haven't already, look at some of the complementary medicine that perhaps you can offer. And you also mentioned about the trials. Everything should go through a trial. And I believe that there's so much that we can learn from through trials, but why not also offer trials from the natural means? We have essential oils that if you Google any essential oil, you'll find they immediately impact any condition that the human or animal body can get. So we're in the middle of a pandemic with COVID. You can also see more information as to how certain oils can impact it immediately. It has nothing to do with our company. It has to do with what scientific knowledge is out there. So my question that I pose everybody, how willing are we to also incorporate natural food-based modalities to help fight this pandemic? Because we all agree that if your immune system is not working efficiently, and if it's impacted in any negative way with any of the myriad of conditions, especially people that don't have as much access to the best medical care, that how can we work together? That's always what we're asking. How can we do as our ancestors did back in Africa, back in when the Native Americans, they didn't have medicine. They had a peace pipe that made things a lot nicer, but they got their medicine from the ground. And I know that most of the medications available now, they do have some natural ingredients, and then you use patented ingredients to make your patented formulations yours. So I'd like to see more conversation, and that's kind of why we're here in this space, to really give a person a chance to live holistically, being a whole person, so that they don't have to remain addicted to opiates for pain. Whereas I know what I can rub on me that relieves pain in 2 minutes, and it's all natural. So I'd like to see more connection, and I'd like to see more education on both sides, how we can work together. And I think Healthy Place Botanicals and Healthy Place Now would be a good candidate to come into the district to show you how we can work together.
Thank you so much, Dr. Banks. Any questions? All right. Don't forget the goal here is to make sure that we are able to put together a plan and a strategy for everything to COVID in our communities. We're dealing with COVID now. We will also have post-COVID that we have to make sure that we are prepared for as well. I think we have Harrison. Sandra?
Oh, La Shawn, I raised my hand so long ago, and I have spoken. I have spoken. Thank you so much. I don't have anything additional to add.
I want to thank everyone for taking the time on this rainy Saturday during COVID to spend time with us to come up with a plan and a strategy for the west side of Chicago. And once again, we have to, are there any announcements? We need to make sure that we have announcements from people that have access to providing food for communities. We know that the struggle is real for food security, and people need access to food. I do see my pastor on. I think that he has a food pantry, and if anyone else could announce any places where we should be teaming up with so that people know that there's access to food, fresh fruits and vegetables, and of course, protein. Also, if you want to have your place as a testing site, we can help you have a place of your desire as a testing site for COVID. We would like to get testing sites all over the west side of Chicago. It's possible right now, so if you know a place, just let me know. Pastor Walsh?
Sure. St. Martin de Porres Church, 5112 West Washington Boulevard. We have a food pantry that is open every Wednesday and Thursday. That's Wednesdays and Thursdays, 10 a.m. until 12 noon. Normally, before the pandemic, we required that people lived in a certain geographical region, but with the pandemic, we've opened up our boundaries. The Greater Chicago Food Depository and our partners has allowed us to do that. So every Wednesday and Thursday, 10 to 12, 5112 West Washington. And we do offer, I believe, a good variety. We do get some fresh produce, meats, as well as standard foods to try to help people out. Tell people if they come, they better bring a pull cart or somebody to drive them, because it'll be more than any one person could normally carry.
Thank you so very much. Any more announcements before we conclude? And we do know that there are plans ahead to make sure that we have budget demands. And so any comments before?
Rep Ford,
yeah.
Virgil Crawford. Just real quick, as you mentioned, the fact that we're dealing with all kinds of emergencies in the midst of COVID-19 pandemic, but there's going to be a post-COVID era we're looking forward to, and I think as a community, I'd like to suggest that we began to look at lessons learned. One of the things I have found, discovered in my work in community and just trying to be a servant is that we frequently encounter emergencies, disasters on all levels. And we find ourselves always having to being in a position to have to react to them. So, I think as lessons learned, we should think about putting in place some kind of structure that would set up emergency protocols. I think, we've gone through enough of them to kind of know what the routine is going to be, and instead of reacting, if we could come up with a community emergency protocol system or something that would across the board allow us to have some systems and operations in place, it might be, we may find that more effective than having to always react.
That's exactly right. And that's our plan. This is a strategy meeting so that we don't have to react. Any other comment?
Yes, sir. Rep. I'm not sure where my hand raised thing is, so I'm sorry for interjecting. This is
No,
Val.
go ahead.
Thank you. I just wanted to share with everyone, this has been, first of all, again, thank you. This has been phenomenal. And I hope to say that I'm not sure if it's going to be shareable, but I would love to pass this along to some resources. But Healthy Place recently partnered with a top tier 3M manufacturer who has owns or part ownership in every 3M manufacturing center in Malaysia, Singapore, and just throughout the Asian Peninsula. And he is just committed to us that he really wants to partner with having medical grade PPE made available without excessive prices added on them. So anyone in the chat who wants to connect us with their procurement officer, I tried to put it in the chat, but it's care@healthyplaceppe.com. It's not free, but it's a tremendous saving. It's authentic. It's available, depending on what your needs are, and it's at such a tremendous price savings. So I just wanted to pass that along as a resource to everyone.
Thank you. I think that we should also.
Rep. Ford,
yes.
Can I make a quick announcement, please?
Yep.
This is Fathers Who Care, Reverend Jones from Fathers Who Care. We're doing various outreaches for Christmas, and I just wanted to extend that we're reaching out to the homeless population in the community. We're bringing them out outerwear, PPE, other essential items that they need to try to withstand some of the hardships of the day. And we're also looking for clinical intervention and support to come out and support the folks on December the 20th. We're going to be on Kedzie and Sacramento, Chicago Avenue between Kedzie and Sacramento. So we're looking for clinical intervention, those who can come out and administer COVID-19 intervention and support referrals, homeless, housing assistance, and the like. So if you're looking for additional information on how you can be involved, we need your help today. Give us a call at Fathers Who Care at 773-287-5821. Again, Fathers Who Care at 773-287-5821. Thank you, Rep.
Thank you. And
hi, this is Deborah Vance. I have a quick announcement. We are hosting a virtual meeting, not just for families impacted by autism, because we all have been impacted by grief of COVID and just the social isolation component. So we are having a virtual meeting this Tuesday at 7 p.m. It's going to be on Zoom, but it's going to be via Facebook. So if you go to my Facebook page, you'll be streaming live through there. And our presenter is Dr. Tiffany Bella.
Thank you. It's great. Yep. We're going to have the ability to have a relationship with someone that has the ability to get PPE. That's critical. We're going to need PPE on the west side of Chicago. So hopefully we can figure out a way that PPE is available for families. It seems like a simple mask is something that's easy to get, but for some people it's very difficult to have a clean mask. Any more comments before we close out?
Yeah. Report. I want to announce that we are still doing.
Well, hold on. You have to unmute.
Okay. Mm-hmm. All right. Thank you. I just wanted to announce that we are still doing free COVID testing at the Loretta Hospital from Monday through Friday from 9 to 12 noon. Because the weather is getting closer, we leased a larger tent. We'll be able to keep people warm with heat inside, be tested for COVID, and we're using the opportunity to sign folks up if they would like for COVID vaccination clinical trials as well. So free testing still. We're one of the few organizations on the West Side still doing free testing.
Thank you. And Ms. Banks, Dr. Banks, you had your hand raised.
Yes. Thank you. I'd like to know if you have rapid testing available. The reason why I'm bringing this up, because they just put on the major news, MSNBC, the anchor has come down with COVID and her entire family. And she was in a panic mode. And biggest reason why she was in a panic mode is because she was not prepared that it could possibly come to her home. And as you know, she is not a disenfranchised person. She happens to be Caucasian and just very well read. So if it can happen to her and her family was not ready, her question was, well, if she did not have a COVID test within the few hours and getting it the positive result, she would have sent her kids out to their 3 separate schools. and they would have infected everybody they came in contact with. So that's why I'm asking about rapid testing. Is there anything, what is the turnaround time to get results?
For rapid testing or for the regular test?
For the regular that's being offered by Loretto or anybody else in your district.
Okay, the turnaround time for the PCR testing, and that's the nasal swab, which is the most reliable, currently is 24 to 48 hours turnaround time. While the rapid test is good, there's a limited number of them, and unfortunately is not as reliable as the PCR test. So that's the better test to be absolutely confirmed. And to give you an example, the White House used the rapid test, and at least 40 people have COVID. So.
Thank you. Thank you so very much. And Merry Christmas to everyone. Happy holidays. And I look forward to working with a strategy and a plan. Pastor, did you have any closing blessings? Pastor Walsh?
You want me to give my Sunday sermon now?
No, absolutely not. Not the long one, but yes.
No, but let's just pray real quick for everyone that's here, a part of this Zoom call, this conference, for everybody that we serve especially, that we'll all continue to put the quality of life first, of all people, of all places, of all races, and especially, of course, we're very concerned about our community, Lord God, this Austin, this West Side General community. We just pray, Lord, you will give us the resources that we need, and that we will be able to work together to properly distribute for the mental, the physical, and the spiritual help of all we encounter. We ask this in Jesus' name, amen.
Amen. Thank you, Pastor. And I look forward to working with all of you. You have a great day. Bye-bye.
Amen. Hallelujah.
Thank you.
you.
Thank you.
Thank you.